Hello. So, this is my next one in the series of talks on asthma. The last time I talked about some of the drugs and drug combination, which includes inhaled corticosteroids or ICS, and something that opens up the bronchial tubes or called bronchodilators combination. This particular combination has been an old medication. However, it is still probably the first line of treatment for mild persistent, moderate, or severe asthma. There are additional medication, but I'm going to continue in this video talk about bronchodilators. Many of the asthmatic patients have allergies, and allergies trigger reactions in the bronchial tubes, and there are literally 3 or 4 different drugs or different types of drugs which are used, but I'll be talking about them in the near future. But at this time, I want to talk about simple bronchodilators. If you remember in my last video, I stated that Advair, Symbicort, Dulera, Brio, these are the medicines or the inhalers that are used as maintenance therapy, which means they need to be used on a continuous basis daily so that they keep the inflammation down in the bronchial tubes, keep the bronchial tube open, and prevent serious attack. When people are taking these drugs, the attacks, if they occur, are less severe and the recovery is quicker. So when they did the studies and found out that when people were taking inhaled corticosteroids, which is in these drugs, they did not have need for quick relief inhaler. They did not need ER or walk-in clinic visits. They recovered quickly from an acute attack compared to the patients who were just using bronchodilators. The bronchodilators are commonly used for a quick relief. Advair, Symbicort, Brio, and Dulera contain bronchodilators, but they are long-acting. The Brio bronchodilator is effective for an entire day. So the Brio is used only once a day. Symbicort, Dulera need to be used twice a day. So is the old drug Advair. So each drug has its own half-life, and that's how this is determined. The bronchodilators that are commonly used as a quick relief is called albuterol. In the past, we used to use something called Alupent, but it is outdated. Nobody uses it. It's not available in the market. Now, the albuterol does come as an inhaler, does come as a tablet, does come as a liquid or a syrup for children or somebody who has difficulty swallowing. We commonly do not use albuterol tablets, but we commonly use albuterol in inhaler or albuterol in a nebulizer treatment or vaporizer treatment. So when people have severe asthma and they can't breathe, the inhaler is like either you get it or you don't, all or none, because the inhaler has to be used very properly and the medicine has to go deeper down into the bronchial tube. Unfortunately, even in the best hand, only about 30 to 40% of the medication goes into the lung, rest is wasted in the throat. So when people are acutely short of breath, can't take deep breath, or are coughing, the amount of medication that is deposited in the lungs or bronchial tubes is reduced and the effect is less. Subsequently, people have started using albuterol in a nebulizer form, where particular dose of albuterol is dissolved or mixed with saline, 2.5 ml to 3 ml, and is given in a vaporized form so that the vaporization lasts about 5 to 7 minutes. The deposition is better and the effect is longer lasting. Again, for younger people who have good lung capacities, And for people that are not in a bad attack, inhalers are as effective as nebulizer. But in an acute bad attack, nebulizer will be better than using an inhaler. The albuterol is a generic name. Albuterol is also available in a brand name called Ventolin HFA, Proventil HFA, or ProAir HFA. The ProAir also comes as auto inhaler, which means it has a breath activation. So one does not have to press it down so that the medication is released, but the mechanism or the release occurs simply by initiating a deep breath. This certainly is good for people who have arthritis. This is also good for people who are old. This is also good for people who have dementia. The medication deposition is improved by using a small chamber. So when I put an inhaler in my mouth, it hits back of my throat and or some of this is inhaled. To avoid deposition in the throat, some people use and prefer using a small tube. So the inhaler is at the end of the tube, your mouth is at the other end of the tube. The size or the length of the tube is about 6 to 7 inches. And this is called aero chamber. Again, the deposition is better, especially in patients who have difficulty coordinating, people who have arthritis, people who are older, people who have dementia, people who have lack of understanding. In younger hands, regular young people, not infants, not young children, aero chamber may not add much. But again, this needs to be determined individually, and in some patients, aero chamber definitely improves the deposition. So we talked about inhaled corticosteroids and long-acting bronchodilators in form of Symbicort, Advair, Breo, and Dulera, which are maintenance drugs. A short-acting drugs, albuterol, is available in an inhaled form, tablet form, syrup form, or is also available in a nebulizer form. Please note that in the nebulizer, many times to improve the effect of albuterol, we add another bronchodilator. The generic name for that is ipratropium. If you remember, what I was saying is that God has given us a mechanism by which chemicals are provided in our body which act in a different way. So as we were talking about last time or last video, adrenergic receptors increase the heart rate, increase the blood pressure, open up the bronchial tube. Exactly opposite of effect occurs when you stimulate parasympathetic system, a system which is not sympathetic. Sympathetic is adrenergic system, parasympathetic is different. And so that particular system, acetylcholine type of system, when we have increase of that, then there is a bronchoconstriction. So blocking that causes bronchodilation. So the drug that is commonly used in the nebulizer is called ipratropium. This is a short acting, it is combined with albuterol. The generic name is ipratropium, but the brand name is Atrovent, Atrovent. And so usually 0.5 milligram of Atrovent is combined with 2.5 milligrams of albuterol in the nebulizer treatment. And it is done as much as 4 times a day, if needed. The same Atrovent or ipratropium also comes in an inhaled form, and it's called Atrovent inhaler. There are a variety of drugs which are long-acting, similar to Atrovent or ipratropium, but not ipratropium itself, that are now available either in an inhaled form or also available to be used in nebulizer form for older people that cannot use an inhaler. I'll be talking about them next time. This is a very basic fundamental information on asthma. I hope you're enjoying it and would listen to it, subscribe to the channel. Till then, thank you. Have a nice day.